I bring a case of a young boy. I started assisting in 2019 when he was 11. He has had psoriasis since he was 6 years old and has been using topics since then. He was obese, with 92 kilos and a BMI of almost 36. He had a severe disease in his palms and soles, thick scales and fissures. He was not able to play soccer with his friends. There were lesions on his body too. At the first appointment, I asked for exams whose results were expected, and I started methotrexate, 15 milligrams a week. He did not improve. He just reached PASI 25. Then I increased the dose to 25 milligrams of methotrexate weekly. 4 months later, in 2020, the patient was using methotrexate, 25 milligrams weekly, but without any response. He did not achieve PASI 75. He had been gaining weight, 4 kilos, and his BMI was 35.57. And he was growing up. When he failed methotrexate, his palms and soles showed a slight improvement in the scales, but there was just a minimal improvement in the fissures and lesion areas. As the treatment with methotrexate did not achieve the goal, we stopped the drug and started acitretin. In Brazil, we do not have acitretin for sale. It is needed a medical report for the government to supply the drug. During 2021 and 22, the patient was treated with acitretin with a good response, achieved PASI 90. Unfortunately, he continued gaining weight, and in 2021, he was 100 kilos. But in July of 2022, he didn't go to the appointment to make the medical report to keep the drug and stayed a month without any treatment. In this period, he had a worsening. I redid the forms again. But 8 months later, even under acitretin, the patient had a secondary failure with a severe flare. His soles were 100% affected, and his palms 50%. There was a severe impact on his quality of life. His CDL-QI was 14, and he gained more weight, 11 kilos, reached 111. These were his feet and palms in March 2023, when under acitretin he had a secondary failure. As he has been failing, even under methotrexate, as well as acitretin, there were no more classical drugs available for him, because in Brazil, cyclosporine is not a drug we can use without an acute severe flare. And for safety reasons, we can only use cyclosporine for a couple of months before starting a new drug. We started the etanercept, again by the public health system. 5 months later, he returned to the office under etanercept, but with worsening. He gained more weight. Now he was 121 kilos. At that point, our next treatment available in the public health system in Brazil for his age was ustekinumab. But there was a drought for several months in public pharmacies. Then the availability was almost virtual, and we didn't know when it would normalize. This is how his hands and feet looked like when he failed to etanercept. He was not able to close his hands because of the lesions. In this scenario, despite knowing that adalimumab was not available for his age, considering I had the medication in my clinic, a donation for another patient, I administered adalimumab and methotrexate and gave him 4 more injections to take home. He took 5 doses of the adalimumab and methotrexate, but he did not improve. His CDLQI was 22. His exams showed liver dysfunction, which I consider it to be due to the drug. As ustekinumab was not available yet, and I had secukinumab, thanks a donation from another patient, and even though this drug was not available in the public system for his age back in 2023, I started secukinumab. But he didn't improve anyway, and he gained 7 more kilos. Now he was 128 kilos. This is the map showing what was available to this patient, considering his age, in the public system in Brazil in December 2023. There was no ustekinumab available yet. He had been failing to anti-TNF and IL-17 and the classic drugs. I had already had successful experiences in severe palm plantar psoriasis, failed, treated on JAK inhibitor. There are some articles in PubMed showing that the JAK inhibitors could be an effective treatment for psoriasis, especially if we consider that some interleukins use the JAK pathway after reaching the receptor in the cell membrane. In December of 2023, this is how his palms and soles were. Considering all these failures and the importance of his quality of life being recovered, it was necessary to share the decision with his mother. Should we wait for ustekinumab availability or try acitretin again? Or we could try a new drug off-label for his age and for his disease that was a JAK inhibitor drug. I explained to his mother that I already had experiences in cases like his, and I had success with JAK inhibitors. And again, I had the drug in my clinic because we had in the samples. I gave him 3 months of upadacitinib treatment, 15 milligrams per day. He improved so much in just 3 weeks. These photos were sent to me while I was on maternity leave. The exams showed no alterations. He has been taking upadacitinib until now and is happy with 100% of improvement. He finally started to lose weight. The government is supplying the drug to the patient by lawsuit, even being off-label. He lost 2 points of BMI. This is the photo, the patient this month, and I think that it's a challenge to treat a patient when we do not reach a substantial improvement. Psoriasis is, as we already know, linked with obesity. This case shows, especially in special areas like palm plantar psoriasis, the importance of pursuing improvement that makes the patient capable of doing exercises and living a normal life. Until the last treatment, when the patient reached PASI 100, the patient was gaining weight and increasing his BMI, as well as his cardiovascular risk, despite his age, as we already know. Thank you so much.